I would say that you're not alone in what you're going through. And number two, I would say what helped me, and I think what would help you as well, is to find somebody to talk to about this. And best case scenario, it's a therapist, or a doctor. But another good scenario is a colleague, a friend in your residency program, in your medical school, in your pre-med classes that you feel you could talk to about these things. And you may have a fear that they won't understand or that they'll judge you. But I would challenge you, as somebody who sees people every single day and talks about mental health, that's all I do every single day is talk about mental health. I'm always pleasantly surprised that the people want to have these conversations. It's not 1980 anymore. These conversations are happening, and they're happening with people that you would never expect. You know, you see somebody like The Rock on TV. You might think to yourself, this guy, he's 300 pounds of raw muscle. He's acting in these movies. He's a bodybuilder and a wrestler. This is a guy that openly talks about depression to millions of people, probably billions of people with his reach. This is a topic that people are talking about, and I would challenge you to have that conversation with somebody because it could really help. And then lastly, I would say, when you feel ready, if and when you feel ready, I would challenge you to try therapy or go to a doctor and take that next step. Sharing with a friend or family member is super helpful, but there's a time when you maybe need to take that next step when things are to the point where they're really distressing, and you don't have to feel the way you do right now. And the way you feel right now won't be the way that you feel forever. I promise. The way you feel right now is a temporary feeling, and that's something that we feel like we get stuck. I'm always going to feel this way. I'm always going to feel this way. But feelings come and go, and depression is not permanent. Anxiety disorders doesn't mean you get stamped with a label for life. With these conditions, you can get better. So I challenge you to take that next step and try to talk to a doctor or a therapist about what you're going through.